Welcome to the Whole Career Podcast with Advent Health. I'm Brandon Strawn, and I'm joined by my co-host, Sky Kellogg.
Each episode features conversations with various healthcare professionals who will share their personal career journeys, insights, and perspectives on various healthcare careers. From nursing to technology to leadership, we'll cover a wide range of topics to help you stay informed and inspired.
Whether you're just starting out in your healthcare career, looking to pivot, or a seasoned professional looking to take the next step, this podcast is for you. We hope to empower you with the knowledge and the tools needed to make a positive impact in your field. At Advent Health, we believe that we are greater as a whole, and we invite you to join us on this journey as we explore the world of healthcare careers together. Today, we have Casie Miller joining us to discuss her imaging career journey. Casie, we're grateful and excited to have you on the show today. Would you mind formally introducing yourself and also giving us a brief overview of your current position with Advent Health?
Yes, absolutely. So, my name is Casie Miller. I am a diagnostic imaging manager for Advent Health Heartland. I am stationed in Lake Placid. My day to day, I lead a mid-sized group of people that work doing x-rays, ultrasounds, CAT scans. We do also have MRI, echocardiography, all kinds of diagnostic imaging, outpatients, inpatients, and ER.
Cool. Thank you for giving us that overview. And so I wanted to just have you break down, which I know we asked you this right before the show, but just so that the listeners understand as we're talking about the different, I guess, how we uh, identify like imaging, radiology. Are those the same? Are those interchangeable terms? Can you just give us that so that throughout the rest of the episode, people totally understand what we're saying when we're talking about that?
Yes. So, imaging, radiology, diagnostic imaging, they are all the same umbrella. It's essentially different ways of saying the same thing. A lot of times we refer to our department as just imaging, sometimes it's radiology, but that encompasses all of our modalities, which is CAT scan, MRI, ultrasound, x ray, even OR exams.
Awesome. Okay, thank you so much. Really, that was for me. Hopefully, for the listeners as well. But I really appreciate that.
And Casie, just to jump right in, I wanted to be able to get an understanding of how you knew you wanted to pursue a career in healthcare.
Oh gosh, I actually have had my eye on healthcare my whole life. I grew up, my dad is a firefighter paramedic, so I have been around healthcare field for probably since I was the age of 6, I would say. And of course not seeing the things that he would do, just that knowing that he was helping people, and I knew that that was something that I wanted to get into too. It just seemed so fulfilling.
That's amazing that you do from such a young age and that you continue to have a passion for what you do. Thank you for sharing that.
Yeah. Oh, I love it. I don't think I could do anything else.
So how did you specifically land on imaging though? Like knowing that, you wanted to help, you wanted to be in healthcare, but what was and I mean we can obviously you can tell us the full story maybe a little bit later, but what was the moment that you even learned about imaging and was like, "Oh yeah, that's something that I might be interested in."
I would have to say that that was probably mid high school when I was playing sports and I had numerous injuries and had to have x-rays, and I thought this is really cool. And from that point forward, I was like, you know what? I could do this.
I love that. That is so interesting. What
It's
sports did
funny.
you play?
I played basketball and softball.
Okay.
So lots of activity, lots of ankle injuries. It's
Oof.
funny how you're introduced to different things.
And just to be able to give our listeners an understanding, because I think imaging is tends to be in the background, right? It's not the first profession that people think of when they think of healthcare as a whole. So, can you give us an overview as to why imaging is so important to hospital facilities as a whole and healthcare as a whole?
Oh, absolutely. So I'm not the first person to coin this phrase, but imaging is what we call the eyes of medicine. So
Ooh, I like
we
that.
may not be the absolute front line, but we're right there. So doctors, nurses, other staff, it's very hard to treat someone unless you know what's going on the inside. And in order to see what's happening on the inside, you have to use some sort of imaging. Um, and depending on the issue, we use all different kinds. But we actually are the ones that are performing the procedures that are helping the doctor to make the diagnosis to be able to treat the patient.
Yeah, no, I've actually never heard of that. So the eyes of medicine.
Yes.
That's what
And I
I'm going to
can't
say
take
that
credit
from
for that, but
that's what I'm going to say from now on. They're like, hey, who was the last episode with? I'm saying we talked to, the eyes of medicine
that's
herself,
us. That's
Casie
us.
Miller. Yeah. No, that's awesome. So what are some of the soft skills, right? Like, I mean, what are some of the soft skills that are needed in the field of imaging and, radiography?
Soft skills, I would say right off the bat, number one is going to be empathy. It's it's a hard field to get into if you cannot connect with the person. And granted, when you're doing an imaging exam, you may only be with them for a few minutes of time, but it's important to make that person feel comfortable because they're most likely there with an injury or an illness, and that's not anything anyone wants to be doing for their day, when they're on the patient end. Um, Another skill would be communication, being able to relay what you need for the patient to do to get the exam done correctly is very important, as well as communicating with your other peers around you. Those are the biggest ones, I think, that having those two they can really take a person far.
And as far as imaging and the time that you've been in it, how much has it changed for you? And what has Advent Health done to keep up with those changes that you've experienced?
Well, I have been in imaging for 21 years, just about 21 years. Um, and the changes are just immense over that amount of time. When I started, I was learning still on taking x-rays on film at times, which we've now come so far that everything is digital. Um, CAT scans have developed to from like 2 slice scanners to 128 plus. And Advent Health has really, especially here in the heartland where I am, they've really maintained our technology to ensure that we're on the forefront of, all of the imaging that's happening. There's CAT scans that can scan hearts. It takes over 128 images a second. Some are
Oh,
taking
wow.
256 images a second. Yeah. Same thing with imaging strokes and doing catheterizations. It's just amazing how far technology has come in 20 years.
No,
And
that
can
is amazing. Sorry, go ahead, Skysa.
Yeah, no, I'm just because I'm curious and personally not coming from the imaging realm and can you talk about the importance of having so many images to work with and how that has increased your care for patients, how that sets you apart from other, facilities that don't have this type of technology?
Absolutely. So, having scanners that work as highly as they do, like at the moment, we have 64 slices and 16 and 32. Those are pretty average. But the more images that you're able to take at a time is the more detail you can give to the radiologist for them to be able to diagnose your patient. It also means that you can look at the itty bitty little structures within a patient's body, and you can do it in such depth and in a small time frame that your patient isn't on the table for any more than a minute or two.
Thank you for sharing that.
Mhm.
Yeah, no, that was a great question, Sky. And I wanted to also ask, MRIs, is that something that you all also are doing, inside of your scope of practice?
Under the scope, everyone begins, with the exception of ultrasound, of having an X-ray degree, so radiologic technology. So you spend the time going to X-ray school, and then from there, many of us specialize into different modalities. Some do MRI, some do CAT scan, some do nuclear medicine. And with each one of these, there's a study period, and you have to collect exams and sit for a board exam. Now, you learn on the job, and then you do all of the extra studying and board exams to be able to do those. So, MRI is its own modality and it does require specialty certification.
Awesome. Okay, so and so that's interesting because when I took my deep dive and trying to, do my research, host research before our episode, I was just amazed at how many different areas imaging can take someone. And I think especially for someone who, like we're hoping that we have listeners that are seeking out information about a new career, or maybe even any high school students or people that are just interested in taking their career or choosing a career. I think it's also good to know that in whatever career you choose, there's different, like, as I think the word you used was modalities, or different
Yes.
divisions, or different departments. Because it doesn't limit you, it allows for someone to, yes, you may fall in love with imaging or radiology, but you can also fall in love with different areas, because we all, sometimes things get not boring, but it may be monotonous or whatever it is. So could you talk to us about some of the different modalities that you've done, and maybe which one was your favorite?
Absolutely. So I started out as an X-ray technologist, and I quickly learned CAT scan, which I sat for a board for with that. A ways down the road, I decided that I was ready to move on to something else, and not that I quit doing CAT scan because that's my love, my home. But I learned how to do mammography, which is breast imaging. It's how we screen for breast cancer. And, at first I didn't think that I was really going to enjoy that, but it was such a great experience and something to be a huge part of and learning. And, I'm grateful that I had that experience to move into something different. But I still have to say that CAT scan's been my favorite right from the get-go.
So, as far as your interest in Advent Health, how did you come across Advent Health, and how did you join the family?
Oh, this is a good story. So 5.5 years ago, my brother was already living down here in Florida, and he has a family, small children, and I lived in Maine with the rest of my family. And I had been trying and trying to find a place to work down here. I wanted to be in Florida and I wanted to be closer to my family and be able to go to dance recitals and ball games and all of the auntie things. And it just wasn't happening for me. It had gotten so that every night I was praying before I went to bed, to just find me an opportunity, whatever's right for me, put me in that spot. And I got an email one day from, I believe it was Indeed, but it was through a recruiting system. And it was for just a technologist job, a CAT scan technologist job here in the Heartland. And they interviewed me over the phone, recruited me over the phone. And I actually had a dance recital to be at of my nieces the next week. And so I came down for the dance recital, had a job interview, and was moved to Florida 2 weeks later.
Wow,
Come
that's
on.
a quick turnaround.
Yeah,
That's
it was.
amazing.
It really was.
God,
Oh,
God works quick sometimes. I mean, I know
He does.
sometimes we're like, God, can you hurry up? But other times it's like, whoa, 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 I didn't know this was gonna happen, so fast. So that's amazing. Okay. And
Yeah,
how
yeah.
long ago was this again?
about 5.5 years.
5.5 years. Ah, awesome.
Yes.
And they say that email is dead, right? It's not.
Yeah.
Recruiting emails are not dead. They still work. Because we have, an awesome now imaging manager. That's amazing. Sorry, go
Yeah,
ahead.
that was divine intervention. That's what I say, because I had
That's
given
it.
in.
Yeah.
I had given
Wow.
in, and here I am. And I don't think there's any better place to be. I don't think I could ever find a better place than this.
What are some of the differences, because of course you were already working in Maine and had experience. What are some of the differences with Advent Health than when you were with any other employer, or just working as a tech? What are some of the differences and the positives about being here as a in imaging?
Yeah, I had 15 years experience at the hospital I had worked at previously.
Right.
And the immediate difference right from the get-go is culture. The culture at Advent Health is just amazing. People here, they're your family. They want you to do well, they want you to succeed, and they want to take care of you. They want to make sure that you're doing well, and not just your patients, but they want to take care of you yourself. And you don't get that everywhere that you go. There are a lot of places that you are just another employee,
Yeah.
and that's not the case here. It was very evident to me right from day one that I was in a place that was nothing like I had ever seen. It was amazing. You can grab a coworker, you can pray with someone if you need to. You can have a conversation, and at the end of the day, everyone here is very caring, but ultimately it's about taking care of each other, and that's not something that you come by easily.
Yeah.
Yeah,
Thank you for sharing that.
yeah, most definitely. And obviously culture has kept you here, but do you have anything else that you'd like to share with the audience as to why you've, stayed with Advent Health for the last 5.5 years?
I also could say that they have great programs for education. So I actually decided to do my bachelor's degree after I got down here. And Advent Health did the tuition reimbursement with me and helped me to get through that completely. And I'm also doing the same with my master's. So, I mean, the tuition reimbursement, the education assistance, and I mean, those two things, along with the culture, I don't know that anybody could ever want to work anywhere else. And the the company wants for you to grow, and they give you every chance possible to do so.
Yeah, and you've definitely taken advantage of that. I mean, you
Hmm.
are now on your master's. So I wanted to ask you, for those that are listening and they're wondering, okay, like where do I start? Like what is a good amount of education to have? Because you mentioned that you were already working for 15 years with an associates. Could you just break down for our listeners, the steps that they might take, associates and then bachelors? I know obviously, that's how it usually works, but from what I'm hearing, you were able to have an established career, with the associates. Can you just mention, what they should be looking to do as far as first step if they're looking to get into radiology?
Oh, absolutely. And one of the first steps that I would recommend is if you're looking to get into healthcare, look at, a first level position. Maybe it could be a tech assistant, something of that nature that gets you into the building. You're actually around the modalities, you're around the people, you're, submersed in the healthcare culture. And that in itself tells you whether you may really want to pursue that or not. It's also a good step to have a foot in the door for when you do go to x ray school, then you can just move that from that job onto being a technologist. So, the schooling for a technologist is about 2 years, and you get an associate's degree. And then from there, you can start working in just about any hospital of your choice as an x ray tech. And from that point, you can choose to specialize in your modalities and do that training, or you can go to different universities. And I do believe that actually our Advent Health University offers this. They do like a bridge program. So you could take and specialize, but you also can get your bachelor's at the same time. And with the education assistance that we offer, it's actually kind of two birds with one stone all in one place while you work at the same time.
And just out of curiosity, Casey, what inspired you to pursue your now master's degree? Obviously, it's a huge feat, and I want to congratulate you on on pursuing that. So, what inspired you to do so?
Well, I actually had a development conversation with my leader, who is the assistant vice president of ancillary services, and we were having a discussion about, where would you see yourself in a few years? And I said, well, I think I'd like to be you. Just kind of teasing him a little, but I honestly, said, I'd like to move up. I'd like to, be a director, be an AVP. I'm like, who knows? Maybe I want to be a CEO.
Yeah.
I said, sky's the limit, right?
Yeah.
And so, and he was so excited about that. And he said, you know what? This should be your next step. Why don't you work on this? Like, let's look into it.
Right.
And that was when I got looking at the education assistance programs that they offer through here. And I was like, okay, let's keep going.
That's amazing.
Nice.
Yeah,
Nice.
what inspiration. I love that drive. That's very inspiring to hear.
And that was, and just so I make sure I'm tracking right, that was after you already had the bachelor's. This was for the master's. Okay, the
Yes.
development. So I want to, and I want to highlight this, which you've already stated at Advent Health, right? And I am a testament of this as well. The managers, the culture, like just for you to be able to have a development meeting. Some
Yes.
places that doesn't even take place, right? You may have a touch point, or there will be like a group meeting for the team meeting, right? But it's so important to still have those supervisory meetings, and these are positive supervisor meeting, right? These are not negative ones, which most people usually have, right? These are meetings about development, and
Yes.
very two different things there, talking about the work that you're currently doing versus a development meeting talking about how do we help you in your upward mobility aspirations. And so I think that it's important, for our listeners, understanding that wherever you are within the Advent Health system, if you're internal, that we do have managers that are interested in knowing how we can help you grow. And that is a meeting that I implore you and encourage you, for our listeners, to ask your manager about. Can we sit down and have that development meeting? Because I know that for me, that rings true as well. Like, I talked to my managers, not only about the work I was currently doing, but I told them about, what I was looking to do. And, sometimes having those conversations can be tough, because there was a point where I was telling them about my aspirations, and it didn't necessarily involve the team that I was currently working on. However, that manager still found a way to connect me with people within the company that could help me. So I just wanted to highlight that, because that story is so powerful, that you were able to have that story with your manager and tell them that, hey, I want to be you, right? And they weren't they yeah, they leaned into it, and they're like, okay, great, let's figure it out, right? Instead of being a manager that could have said, well, oh man, this person wants my job, totally not going to help this person. So very powerful, and I really appreciate you sharing that part of your story.
Yeah. And he's been a great mentor to me as well. And there is nothing better than having a leader that's like that, that shows you how to lead, and they empower you to do the same with your team. And that goes right back to the culture here, that it's it's a love me culture, I guess, as our service standards would say.
Yep.
And that's one of the biggest things with Advent Health, is that they want you to do well. They want you to take the knowledge that you learn and grow with it. And if I can help somebody do that, that would be great.
Yeah, and Casey, I would love for you to share with the audience what motivates you. What is that drive that has kept you going through education and changing companies and just being so passionate about what you're doing today?
I think drive mostly is that this is always something that I have wanted to do, but I never really had considered just how far I could go. And so now I just have this fire of like, how far can you take this?
Yeah,
How far can we go? How many people can we reach? And and I also think about like my nieces and nephews, and they're watching, and they're being inspired, and they're learning that it does not matter if you start today or tomorrow, but if you have something that you want to do, you do it. Put your all in it and see where it'll take you.
I love
And
that. I
having a little
love.
faith.
Yeah, I love
Got
that
to.
that you're inspired though by your nieces and nephews, and that you're setting an example for them, and uh, that is just a beautiful picture. Thank you for
Yeah.
sharing that.
Definitely. And if I can take this back a little bit as far as timeline goes, as far as I was going through your LinkedIn once again, total kind of research slash stalker moment, but
Yep, have
um,
at it.
I I saw that it mentioned in there that you were working with surgical services and at one point like providing treatment. So I wanted to just
Mhm,
make sure, what is it? I was a little bit confused when it said providing treatment. I know that you all are taking the films or the pictures, right, or the scans, excuse me, so that you can provide to the doctors. What
mhm.
does that mean when you mentioned, that you were assisting with providing treatment for surgical services?
So a lot of times we'll do procedures where you actually are um, gowned up and sterile, like interventional type procedures, or in the OR, you'll be actually handing the doctor things or using a C-arm to take the pictures to be so the doctor knows exactly where to put the needle. Um, Doing things such as pain clinic, that's actually a really good example of that because the doctor is putting in a needle to the patient's spine to be able to numb a nerve or check a facet joint or anything of that nature. And it requires you being absolutely on point with your images and perhaps helping him in any way that you can to show him exactly where he needs to be.
Mine officially blown, because I think, even for me, like, I've had a ton of injuries. So, I've always known, like, okay, I got to go get this x-ray. The person's going to take my x-ray. They're going to let me know, let the doctor know. And then I never see that person, again. And
Mhm.
so I think it's awesome you explaining that there's so many different modalities, but even within the modality, there's different, you could be at a different step, in the process, I guess, of treatment, which, a
Yep,
lot of people only see you all at the beginning. So I would have
right.
never thought that you all are helping in surgeries and, making
Mhm.
sure that the doctor can even see things, correctly for when they're putting in medicine and different things like that. So that was like
Yes.
a, a huge mind blow.
Yes.
But yeah, appreciate you sharing that. Thank you.
Mm. So here's another piece that might blow your mind a little bit. Um, the technologist that works in the cath lab, a lot of those are X-ray techs, and then they take this special education to become what they call a cardiovascular tech, and they're actually running the imaging machine that's showing the cardiologist where to put the tubes through to be able to do stent placements and things of that nature. There are just so many avenues that radiology can take you.
Yeah, that's actually that is one area. Now, there's a reason I'm in HR. I am not someone who is meant for the clinical realm, but I did do a tour of the cath lab and seeing the way that that works and watching some live procedures. And one thing they mentioned about personality types for someone in that particular modality is that they have high adrenaline. They're really driven by that, right? Because it's
Hmm.
just matter of moments in regards to how quickly things can move to save a patient. So, what would you say is the overall personality type or traits that are important to have when going into like your favorite area, like being in CT scanning or mammography? Are there different? Would you say that there's something that is unique, like the cath lab, that people should be aware of?
Um, it really all depends on the area that you're specializing in. But
Hmm.
if we're talking about just straight radiology and X-ray, adrenaline is one because we are in the ER aspect. A lot of places do have trauma, and X-rays are a necessary portion of that. So
Yeah.
being able to jump in and go whenever you're called on is definitely one ability that some people have and some people don't.
Yeah.
Now, I mean, there are other areas where, like in MRI patients, patience is a wonderful thing because MRI takes longer than, say, CAT scans and ultrasounds, and you're spending more time with your patient. So that's where your empathy comes in as well. Um, Same thing with ultrasound. So patience is big in ultrasound because you're with them and they are right in front of you while you're actually scanning. Because with ultrasound, they're not using X ray, they're actually using sound waves to look at different parts of the body. But the patient is right there with you. They can see what you're doing. They talk to you. They want you to make them feel a little comfortable. And you also kind of have to be a little bit stoic because you don't want to give away what you're seeing as you're scanning people.
Yeah.
And I think that's actually a learned skill that comes with time for any area of radiology.
Yeah, I can imagine that can become quite difficult. How do you and your team members cope with things like that? How do you feel you learn? Is that only with time, or um, what advice
I
would you have
think
for someone who's thinking about pursuing this and knows that that may be a difficult aspect of these roles?
right. And I think that with any type of healthcare position, that is a worry for people is how do I deal with what I see, and what I come in contact with. And for us, I mean, it is learned over time. You learn how you deal with it yourself. But for my team here, like when we see things that are, I wouldn't say hurtful, but they kind of discourage you a little bit, kind of knock you down a notch. We talk about it.
Hmm.
We'll like I have a mid-sized team. We'll sit down, a couple of us, and I'll be like, "Are you okay? How are you doing? Let's talk about it. Let's get it out in the open."
Hmm.
Especially for newer techs that are coming out because they're not used to that. That's not their everyday. Whereas those of us that are a little more senior, you know, we've learned over time how we like to deal with those things, but it's still good to talk it out.
Yeah.
Still good to have somebody that can listen and kind of get those feelings out in the open and move on to the next one.
Oh, no, appreciate you sharing that. And I wanted to just, I know that you've done all the scans there ever was to be done, but now you're in a management position. And as imaging manager, what are some
hmm
of the things that you do daily as a manager? Not necessarily maybe the scans, like actually doing them yourself, but what are some of the duties and responsibilities that you do now as manager?
So now, as manager, I am checking metrics to make sure that we're staying on task, making sure that our patients are being taken care of in an appropriate time frame. I'm checking survey results to make sure that our patients are feeling cared for as they come through and to see if there's any directions that I need to, disperse to the team. Is there any way that we need to look at doing things differently so that we can approach our patients better? I'm scheduling technologists, making sure that all of the bases are covered for each shift and making sure that our outpatient schedule is running on time, that we're keeping our people moving, as well as being able to take care of our emergency patients and our inpatients as well. So I like to make sure that, the day runs smoothly. And in between, I also have different meetings with other managers and different modality instructors as well. And I also, during college season, I also am a clinical instructor and work with the students as they rotate through.
Oh, that's amazing. I'm sure that's
Very.
very rewarding for you.
Maybe, maybe not. No, just kidding, just kidding. No, well, I do. I know. Well, I do want to ask because as a manager, is that a responsibility that is required, or is as far as working with the clinical students, or is that something that you offered to do?
That is something that when I took over this position, that was the manager's job was to take on the students. I easily could hand that off to one of my techs and say, okay, well, you be the clinical instructor because I've got, this and this and this going on. But I kind of enjoy it, actually. It's quite nice to be able to work with them and show them different techniques that I've learned along the way and to be able to kind of mold them into, our culture and the way that Advent does things. Because ultimately, at the end of the day, they are going to be the technologists that are going to take care of us when we're older. And we
Yeah.
want them to be really good.
Right. Right. And I think I'm glad that you, and I asked that specific question because when you don't have to do something but you choose to do something, it just shows like the level of leadership and the level of management and the level of care that you have in your job. And to know that, these clinical students, I think it's also a good time for maybe even you to learn like something and keep your ear to the ground as to like, okay,
Absolutely.
what are right, like what are colleges teaching our new techs now and different things like that. So I think it's awesome that you've actually decided, or intentional about taking that on, because I think it's definitely, something that is valuable to the text, the new text. So that's awesome.
Yeah. Yeah. And we actually have a college right here in our area, South Florida State, and they have a medical radiography program. And so their students do their clinical through Advent and a couple of the other area hospitals. So it's really great. We get to, see them all progress as they go through the program.
Nice.
And have any of those students that you've worked with joined your team by chance?
Oh yes. Oh
Awesome.
yes.
That's wonderful.
Yep.
That
Many
must
of them.
be,
Many of them
yeah,
do.
that must be great to see that whole process come full
It is.
circle.
It really is. And when they graduate and we get invited to the ceremony, it is just awesome to be able to watch those people that, you molded into a wonderful tech and they get to go get their certificate and start work.
Yeah.
It's awesome.
Nice. So Casey, I wanted to know, I know that you may not be experiencing a shortage, and a lot of your needs have been filled where you are. But as far as the Bureau of Labor statistics, I saw on there that as far as radiologic technologists are concerned, there'll be a 9% rise in the demand between 2020 and 2030. So just wanted to know, what do you think the reason is for the rise in demand of, of techs, of radiologic techs?
Yeah. And, we do still have a little bit of a need here, but not as much as some areas do. I know there are a lot of areas right now that are working with a lot of traveling companies, and there's a very large shortage in some areas. I think that one of the biggest reasons that we are still feeling the shortage from is COVID. Now, I know that when people think of COVID, they don't automatically think of x ray techs as being, the people that were dealing with the patients all the time. But the reality of it is that every COVID patient needed to have an x ray done. And so that meant that the x ray techs had to go in the rooms or at least set up the board and be able to take the picture through the window. So we were in there, just as much as the nurses, and it really takes a mental strife on people. And I think that a lot of people were burnt out. They really saw a side of healthcare that they weren't used to and didn't want to be dealing with at the time. It was a very large struggle for everyone. And I think that that has deterred some people. They've either left healthcare or they've thought twice about coming into it. And so I think that that's where some of the need comes from. And also, I think there may be a part of it that the need is maybe that we haven't got the word out there as much. Maybe we need, more podcasts like what we're doing today to tell people about, these different programs that they have and how they can actually get into healthcare and how great it can be.
Yeah, definitely. And especially thinking back to the story you shared with us and how you came up with the idea of looking into this as a career. It wasn't something that was displayed to you in school or, taught through a presentation. And I think that is missing. And that's something we've certainly heard many times about imaging, that it is, like you said, the eyes of healthcare, but not really known. It's not well known. So I do hope that this conversation that we've had today encourages others to think about imaging if they're thinking about pursuing a career in healthcare or changing roles. Right, it's never too late to change
It's never
careers and
too
to
late to change rules.
think about that as an opportunity for the future too. So what encouragement do you have for others that are thinking about going into imaging, over these next 7 years when we see this increase? What encouragement and positive aspects do you have to share with those that are looking into this career?
I would say that if you're thinking about doing it, just go ahead and jump. Just do it. Get right in there. Look at every aspect, anything that you could have an interest in, just put it right out there and start because we need the help
Yeah.
and we would love to have new people. There's just there's nothing like having fresh people coming through the door that have learned new ways that can, kind of teach us all different things that education changes so much as you go through that um, it's great to have new people coming through and teaching us old people. I say old, but us more senior technologists.
Right.
They teach us all the new techniques that come through. So we always love to have new people coming.
Yeah. Yeah. What was and we'll wrap here in just a bit. What does the next 3 to 5 years look like for Casey Miller?
Oh goodness. Well, I'll have finished my master's degree come February, and I'll have
Woo-hoo.
graduated with that. Woohoo!
Yeah.
Exactly. And I am hopeful to, in 3 to 5 years, have a director's position at one of our Advent facilities. If not here in the Heartland, I certainly would love to stay with West Florida or wherever the good Lord takes me. And, I also would like to maybe go a little further than that. I would be well interested in an AVP position or even more.
Yeah. Beautiful. That's beautiful. And I think it's a perfect reminder for someone. r- You started out in imaging, right? Still in imaging, but
Mhm.
then now you're like moving into more of like management and administrative and executive type of role. And a lot of people don't think that far from the beginning, and that's fine, right? You want to jump, as you just said, jump,
Mhm.
get into it, but know that there's limitless opportunities. You don't have to continue to serve in one capacity for the entire time. And because executive levels, presidential levels, like they need a different thinking from every type of person, right? So you can't just have
Mhm.
everyone, with the same mindset. So I'm glad that you're making that you have those aspirations, because it just shows that your typical CEO or whatever, right? Maybe they didn't study finance, maybe they studied radiology, but that's where they got their start, and that's how they
Right.
were able to see different aspects of the hospital, and that's what makes for a really well-rounded executive team, is having those different executives be from different areas and departments from within the hospital, because it just makes it really well-rounded, like I said. So yeah, that's awesome. That's awesome. I'm excited. I
Absolutely.
I am excited to see you just like crush it over the next three to
Oh, well,
five
thank
years.
you. Me too. I hope so. And when I started 21 years ago, I had no plans of ever having my own office. I
Right.
just was going to be an X-ray tech, and that was great. And here I am.
Here, right?
Here I am. Who knew
Nice.
that a little girl from northern Maine was going to end up in South Florida? you know.
Oh, Northern Maine. Yeah, there you
Yes.
go. There you go.
And
Cool.
that passion is really what sets you apart, Casey. And I'm sure the listeners will obviously have picked up on that throughout this conversation. So we appreciate you sharing your story, and being able to translate that passion into the work that you do every day is inspiring to us and everyone listening too. So thank you.
Oh, you're very welcome. Anytime. It's my pleasure.
All right.
Awesome. Awesome.
Well, we can jump into our special segment, which we are going to do a little rapid fire questions, just so our listeners can get to know you a little bit more on a personal level. So I will go ahead and get us started. We'll just do a few before we wrap up today.
Okay.
But are you a morning person or night owl?
Morning.
Oh. Beach or mountains?
Ooh. I'm gonna say beach because I grew up in the mountains.
Favorite food?
Pizza.
Dogs or cats?
Um, both. I have a cat. Love dogs.
Favorite way to de stress?
Um, reading. And also the gym, massage, things of that nature.
Nice. So coffee or tea?
Coffee.
And how?
Favorite
And
book? Oh, sorry.
oh no, no, go ahead, go ahead. I'm not gonna ask. I was gonna ask how she takes her coffee, but I just wanted to see if she was one of those crazy order Starbucks people. But never mind, never mind.
I totally am. I am a grande decaf Americano with sugar-free vanilla syrup and a splash of cream.
Brandon, how did you know?
I I
You had a
sensed it. I was
sense.
just like, I had a sense, but then I didn't want to call her out, and I was like, but as long as you don't ask me to get you coffee, we're all good because I'm gonna forget. I'm gonna forget it. I'm gonna
No, no, no,
forget
no.
that order.
I'll order it on the app and you can just pick it up.
Oh, yes. Okay. Yeah. Yeah. Technology. Yep.
All right, we'll do one more. Favorite book or movie?
Oh, my favorite book. Gosh. Anything by Brene Brown.
Love that.
Um, as for movies, Pretty Woman from way back in the day.
Awesome.
Awesome.
Thank you so
Awesome.
much, Casey. Thanks for having fun with us on that.
Oh, it was great. Thanks for having me.
So we just wanted, one final thought. What do you want people to take away from this conversation, and how do you hope that the story will impact others?
One thing that I would love for people to take away from this is that the world of imaging is vast and it is wide open and ready for people to jump in feet first. And we would love to lead the way, especially here at Advent Health. We would love to show people, the way here. Um, and if you have any inclination that you might enjoy doing imaging, then try it. Any Even if it's not imaging, if there's something that you want to do and it is totally different from what you're doing, that's okay. Give it a try, jump in. You know, if you want to go back to school, do it.
Thank you so much. All right. And thank
Absolutely.
you for listening to the Whole Career Podcast. Be sure to subscribe to the show on your favorite podcast platform to stay up to date with the latest episodes. And if you have any questions or topics you'd like us to cover, feel free to reach out to us on Instagram at Life at Advent Health. Until next time, take care. Thank you so much again, Casey. We appreciate you.
Oh,
Thank
thank
you.
you.